Sneezing, runny nose, winter allergies may be to blame. Here this morning to give some advice when it comes to treatment, what you can do, Dr. Nicholas Lukacs with Queen City Ear, Nose, and Throat. Good morning to you.
Good morning. Thank you for having me.
So when we're talking about allergies, I know I mentioned, sneezing, things like that. What are all the symptoms that someone could experience?
Sure. So a lot of the common symptoms that people have are things that we all think of, like nasal congestion, runny nose, sneezing, itchy eyes, nasal drip. And fatigue, really, when you have a lot of allergy symptoms, it really makes you feel run down and tired. So I think those are some of the more common symptoms that we'll see.
And I know it varies from parts of the country to parts of the country. When it comes to allergens, what are the most likely culprits in the Carolinas?
Certainly. So when you're talking about allergies that particularly flare up with seasonal changes, you typically think of pollens. So in the springtime, tree pollen is very prominent. In the summer, you transition to grass pollen, and in the fall, weeds. But for some people, they have allergies throughout the year to things like mold or dust or animal dander like cats and dogs.
Yep, that's me. And I had no idea that I had so many things causing trouble with my allergy issues until I got tested. So for somebody who maybe doesn't know about that, what's that process?
Certainly. So in most cases, allergy testing is done in the office. And most commonly, we do what's called skin prick testing, where we're basically pricking the skin with the different allergens that we're testing. And based on their reactions, that allows us to tell if they do have allergies. And it's a really tolerable test for both adult and pediatric patients both.
Yeah, it's not something that anybody should be worried about doing. It was a very pretty easy process. Now, treatment-wise, you've got a lot of different options. So you can do medication, or you can do allergy shots or allergy drops, which I wasn't even really aware of.
Sure. So obviously there's a lot of different medicines that we know of that you can use to treat allergies, but for those patients whose medications don't control their symptoms, there's what you call allergy immunotherapy. And allergy shots is probably the most common thing that people know of, but growing in popularity and increasingly more common with our patients is allergy drops. It's a treatment where you can actually do your treatment at home with drops under the tongue. You don't have to go to the office for weekly shots. So it's a really beneficial option for young kids, busy working adults.
And not only is this something you treat, but you've had your own experience, and because you moved here from the Midwest, and that's when things kind of flared up for you.
For sure. I've had allergies most of my life, and I was treated when I lived in Michigan, but kind of like you, moving from the Midwest to North Carolina, a lot of different pollens and things that I hadn't been exposed to, and I developed a lot of allergy symptoms here. And so I've been doing the allergy drops since I've been here about 4 or 5 years now, and it really has made a significant improvement. And even though I work at Queen City Ear, Nose, and Throat, the ability to do that treatment at home just makes the process very simple.
And typically, do you want folks to stay on treatment for a long period of time, or does that vary based on maybe severity or?
So for all patients, I explain to them it's more of a long-term fix than an immediate change, but it's usually a 4 to 5 year treatment process for most patients, and then we kind of reassess once we get towards the end based on their symptoms if it's something that we want to discontinue or continue on based on how they're doing.
And if someone is interested in finding out about getting checked out, what some of their options are, how do they get in touch with you?
So the easiest way is you can look us up at queencity-ent.com or call us at 704-703-1080 and be happy to see you.
Awesome. Dr. Lukacs, thank you for the time this morning.
So much.
Appreciate it.
Yeah.